the President of the Editors Guild, ladies and gentlemen, good afternoon. Allow me to begin by correcting Dr. Mercy Koril. I am neither a replica of Mutahi Kahiga nor a relative. My name is Mutahi Kahiga, and there is a difference between Kahiga and Kahiga. Kahiga means a small stone, Kahiga means one that shall fall. I think we are, I needed to tell Daktari, so she does. I know many people make that mistake of Mutahi Kahiga, Mutahi Kahiga, but it's really Mutahi Kahiga. So, ladies and gentlemen, as I stand here as someone who has recovered from COVID-19, having spent about 20 days in a hospital and coming out, and even as we address this issue of COVID-19, which clearly has brought out the inequalities that we have as a country, it is important that we also continue noting that it is possible to win the battle against COVID-19. As a Council of Governors, the 47 counties have the mandate of running the ECD, that is the Early Childhood Development Education, and also the VTCs, which are vocational training centers. Those two sectors have been given to us by the Constitution, and we endeavor to work very, very hard in an attempt to answer Daktari's questions, because many of those questions could be directed to us. Maybe we must understand that everyone has a right to education, and it shall always be free. That is what it says, especially for the lower levels. But for quite some time, the ECD aspect has been neglected. If you walked into any school in Kenya and you wanted to know where the ECD is, look for the worst classroom. That's where you find the kids in ECD. Counties have struggled to ensure that they change that narrative. And most of us as governors have put in a lot of funds towards building better facilities for our young kids. Those who have done psychology will tell you that who you are, what you are, how you do it was shaped in the first 7 years of your life. The rest is a struggle. But as a country, I think we get our priorities wrong, because we build wonderful classrooms for Form 4s and for Standard 8s because they are candidates. But we forget the basics. Where I come from the mountain. There is a saying that a herd with no calves will perish. A herd with no calves will perish. And it goes upon us to focus on the calves. Sometimes you even ask yourself, between the calves and the cows, who can fend for themselves? And clearly it comes out that as the calves struggle to survive, the cows can handle and survive on their own. Having said that, it is also important that we remember, like Daktari has talked about, the rights of children. I will tell you here, in the presence of many editors, that what you are talking about is a drop in the sea. You have not heard the stories out there, because the injustices that have been meted upon those 3-year-olds, 4-year-olds, 5-year-olds will never be known. Because it is almost clear that many times it is perpetrated by those known to the child with threats, and therefore the child remains mum, and until they are adults is when many of them are able to open up. And so even as we think we have heard anything, the stories we hear, the harrowing stories out there have not reached the media. And it's upon the media, because they have a duty to inform, to reach out and bring out these stories so that we can follow the perpetrators and bring them to book. At the same time, we will also be able to offer psychosocial support to those that have been affected. Like I said, COVID-19 just brought out the inequalities in ourselves. Both the county governments and the national governments put in efforts to try and track resumption of education. But even over the 9 months, you would hear stories until you wonder. When someone wakes up and says that we have now decided that we are going to do online learning, the fact that we are saying we'll do online learning does not make online learning available. We know there are areas where even the mere challenge of network is a problem. The Wi-Fi, the phones, understanding what has been taught, because children many times are exposed to learning from their own peers. It is a challenge, and I'm glad the parents are here, because I would want to say this, that our homes are no longer safe. I would rather that the children are in school, because in school it's a controlled environment. But look at what is happening in our homes. In our hustle and bustle to try and make ends meet, children have become a non-essential factor. Sometimes we don't even care whether they ate or they drank. We don't care because when you wake up at 6 and you go to work and you leave them in the hands of whoever, God forbid, and you come back late in the evening, do you really know? Are you there to sit down and listen? I will give you an example. My own grandson, who has been out of school for that long, went and sat down to do an interview because he wanted to change schools. And he was given a paper on mathematics. He is in class 7, was in class 7, and was tested in a test, mathematics test for standard 7. 25 questions, he got 1 over 25. So, as we sit here, let us understand that as parents, we have left the children to their own devices to do what they want because you are not available. While I know one of the rights of a child is to have a family, are our families functional or are they just there? I know it's not kind to tell you that, but it is the truth. If that is the environment our children are growing in, can we wake up and say that really these children, especially the lower classes, are getting the attention they need? We have handed them over to our house helps, to our relatives, where we can't afford house helps, and we do not even know what they are taught. I am sure a mother, any mother, is able to guide their child into the personality and the person they would love to see. But when you go to our schools, you are shocked by some of the things you hear in our schools. I will tell you one thing. The other day I had a harrowing story from one of our ECDs. One of the boys went to the girls' toilet and he stood there near the door, and every girl who came, he would tell the girl, touch me. You know, touch me, and it is inappropriate. He was very careful. All dark girls were not allowed to touch him. he wanted the brown ones to touch him. And this is a child who is 4 or 5 years old. When the story, when the teachers took time to go and find out what was really happening, this young boy had been taught by the house help to be touched. And so as we speak, as we look at this environment that our children are growing in, let's take in a little bit more. Government cannot get into our families and do what it's supposed to do. Government will not get into our families and change the way we are living. We have a duty, despite the child having a right to be born. You must also take responsibility and ensure that these children grow up in the very best way. Let me say that as a council of governors, right now we have ensured that within our ECD centers, which are about 15,000, we have started what we are calling child-friendly counseling and monitoring of the child rights within those small sections. Number one, I am sure many of you know that some counties are still struggling to hire ECD teachers, qualified teachers, because ECD has never been given the same treatment as primary school education or even tertiary and secondary school. These teachers that are trained, we have now gone further to ensure there is collaboration between our departments of health and education, because our children need psychosocial support. And I'm glad Daktari has brought it out that a child 4 years old can get depressed. Sometimes when you get a drunk father who gets home every other day and starts shouting, fighting the mother, causes trauma in that house and depression. And if you look at the way the children behave, it is clear there is a problem. So we are struggling as a county of governors to ensure that we can bring back some semblance of normalcy. As we speak, ladies and gentlemen, I would want you to know and think about some 4-year-olds who are due to join ECD this year but cannot join because there is no room. We were not able to check out standard 8 and the pre-primary. So we have the baby class, the pre-primary, and at home we have 4-year-olds who are supposed to be in school but are at home, mark timing, waiting for these ones to clear that they may come. It's a big challenge. What's happening to those children? In whose hands are they? Are their rights being violated? That's what we need to find out. Because now they are there, they are at home. You all agree that you are not the best of teachers. Some of you, if you tried to teach your children, it becomes a battle. Because you cannot understand why your child is not able to understand what you could understand while in school, Mr. President. But I will tell you, you didn't make that baby alone. And in Kenya, before you get married, nobody requires a CV. We just marry. Beauty or strength, the rest shall be found in the genetics. So, I must mention as I finish the challenges that we are facing right now in our reopening of the ECD centers. Number one, our children, despite them being 5-year-old and 6-year-old, because we are joining standard 1 at 7, we are expected to produce about 1.5 million child-friendly masks. This one is not friendly to the child because it's purely made for an adult. We are meant to give them. Our teachers must go further. I know, I had a story that on the day they opened school, one child came home with 6 masks, 6 different masks, and you understand what it means. Number 2, 20,000 ECD learners have been affected by the closure of schools due to flooding events in various counties. You remember Homa Bay, Baringo, where an entire thousands of acres have been taken up, hotels have been submerged. LKU Marakwet and are some of the most affected. We have a conservative figure of about 20,000 learners who have nowhere to go. The county governments have been struggling to provide adequate water and hand washing stations. We have also endeavored to increase the school meals programs that Daktari mentioned. And we can say comfortably that learning has started despite all the other challenges. I can stand here and say we have a big problem with social distance. Ladies and gentlemen, as you deliberate, as you discuss this matter, as you get your pens and papers, please, 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 I want to urge you, let us tell the untold stories and let us tell them the way they are, especially where we are dealing with the young, very, very young out there in our schools. May God bless you so very much.
Let me add another round of applause for His Excellency. You have had